Welcome to my podcast. So today I'm gonna talk you through counseling stations. So basically we have four category of counseling. So the first one could be for a review for medication or drugs that the patient is taking. It could be for blood test results that you will be counseled for. It could be another category, which is assessment risk of diseases. And the last one could be pre-surgical assessment. So it's basically for any case that will undergo surgery or operation or any sort of procedure that you need to check if the patient is fit for the operation. So let's start with the medication review, mostly for a patient who's on multiple drugs, say for instance to lower the blood pressure. So sometimes the patient might have arterial hypotension. So I need to review the drugs and try to modify and minimize, in order to minimize the side effects, especially for the elderly who might trip and fall accordingly. For blood result, like for instance, someone comes to you with some deranged blood results, say for instance, lipid profile or any other sort of blood results. So I need to explain that result to the patient and act accordingly. Or if the patient, say for instance, taking anticoagulant, you need to explain the expected side effect like bleeding, and to be cautious about, for instance, to avoid anything that might increase the risk of bleeding or injury. Assessment for certain diseases, as the name implies, certain diseases have some associated risk. So according to the diagnosis of the disease, you need to explain to the patient what could be that associated with. Pre-assessment is basically about telling about the procedure. So what this operation would involve and what information the patient knows so far. You need to explain the operation in details and address the patient concern. Also, you can give the patient information leaflet about that operation, so he can read through, and if he's happy about it, you need to tell also the pros and cons of the operation. If the patient is happy, so he can sign the consent and go ahead. Also, you need to check the lifestyle and if there is any medication that the patient is taking, because sometimes certain medication might be modified or stopped before the procedure. Also, for instance, for the counseling, it's always you need to address any concern that the patient might come up with. So the counseling, there are about 10 to 18 cases, stations, and in the exam and lab 2, there will be like 3-4 cases that you need to counsel the patient for. In my case, I remember it was chronic obstructive airway disease. So in that case, you need not to forget about the smoking, which is the main factor or the main risk factor. So you need to talk to the patient about smoking and lifestyle, and if he's happy to minimize it and try to stop it, because you can't force the patient to stop, for instance, all of a sudden. So you need to talk him through pros and cons. and understand their main worries and try to help them with the ways how to tackle this issue. You could say, for instance, we have a smoking run clinic whereby they will help you about stopping and quit smoking. So by that, the patient will make up their mind and they will tell you, yes, I would love to know more about it, and start over. Also, for the blood result, you need to ask if the patient is not one of your regular patients. You need to ask why those blood tests were requested at the first place, and if he's taking any medication, and if they have any concern or any main worries. So according to that, you will tackle the issue. For the lifestyle, it's always mandatory to bring that in the consultation or in the counseling. You need to ask the patient their lifestyle, if they are following a healthy lifestyle, for instance, if they are physically active, what sort of a diet they eat, inquire about, of course, alcohol intake and smoking. So that's basically, in short, about counseling. I hope by that I just brief you through the main points, and all the best.